Across dozens of high-end commercial buildings, tenants form their primary impression of building cleanliness in the washroom. Every architectural detail in the lobby is forgotten the moment a tenant encounters a single drop of contaminated water. A visible hygiene failure compromises the perceived operational standard of the entire facility. Property management often operates under the assumption that aesthetic cleaning and biological hygiene are the same discipline. General cleaning is aesthetic maintenance. It focuses on surface-level dirt, mopping floors, wiping mirrors, and emptying paper waste. Commercial hygiene is a technical discipline. It manages biological risk, mechanical system performance, and regulatory compliance. A specialized program begins by mapping every fixture, dispenser, and waste stream in the facility to create usage-based schedules for different tenant zones. When hygiene duties are bundled into a standard cleaning contract, one or the other is inevitably underserviced, leaving high-risk elements neglected. Treating hygiene as a mere extension of mopping is a systemic failure that triggers tenant complaints and exposes the building to compliance liabilities. Consider the mechanical baseline for legal sanitary disposal. The law dictates the use of sealed, tamper-proof units that meet specific environmental protection guidelines for clinical waste. Standard cleaning crews often attempt to empty these bins on site. This creates severe biological cross-contamination risks. Proper hygiene logistics dictate full unit replacement, entirely removing the hazard from the facility at every service interval. But the timing of those replacements exposes a major operational flaw. Relying on fixed-frequency servicing schedules guarantees that some bins overflow while others are replaced empty. This chart compares disposal unit fill rates across a standard commercial property. By tracking the data, we expose a clear anomaly. Ground floor units fill 40% faster than upper floor units due to spillover traffic from nearby retail zones. Acting on this data allows for immediate operational adjustments, shifting the ground floor to weekly service while maintaining fortnightly upper floor schedules addresses the actual usage patterns, saving the client money without compromising safety. This specific containment methodology has resulted in a zero-incident spill rate over a 10-year period across premium commercial portfolios. Replacing arbitrary scheduling with usage-based data eliminates the guesswork. It cuts out wasted budget and drops tenant complaints by 34%. That same mechanical precision applies to hand hygiene. Touchless dispensing systems are the primary defense against cross-contamination, removing physical contact from the process entirely. This diagram illustrates the highly specific mechanical calibration required for liquid soap. Effective dispensing relies on an exact 1.2 milliliter dose. This specific measurement balances the exact volume needed to produce a sufficient 20-second lather against the cost of consumable waste. When dispenser data is actively monitored against building occupancy, mechanical failures become visible. At one commercial complex, soap consumption spiked 60% above predicted occupancy. The cause was a faulty unit releasing double doses. Recalibrating that single faulty unit immediately secured $480 in annual savings for the client on soap consumables alone. Unmonitored mechanical inefficiencies in dispensers act as invisible, massive leaks in a facility's operational budget. The most frequent and reputation-damaging tenant complaint in commercial real estate is persistent washroom odor. The industry relies heavily on the aerosol masking myth, but heavy fragrances merely hide the problem. They do absolutely nothing to address the biological source. This 3D model reveals the hidden culprit behind 70% of odor cases: inadequate mechanical air extraction. If the room fails to meet the required air changes per hour under standard engineering codes, the odor will remain trapped. The secondary culprit is one that mechanical cleaning cannot physically reach: organic matter accumulating and rotting inside the drain pipes. The required solution is chemical. Pumping enzyme-based treatments down the drains on a monthly cycle actively breaks down the sulfur-producing matter, attacking the biology directly. True odor elimination is a strict matter of ventilation engineering and targeted chemistry. Ambient fragrance is irrelevant. Accessible cubicles demand specific engineering and mobility standards. Their hygiene needs are entirely different from standard facilities. Standard cleaning checklists contain a critical blind spot. They completely ignore accessibility-specific touchpoints. Looking at this heat map of an accessible layout, the data discrepancy is clear. Accessible grab rails average 22% more daily contacts than standard cubicle door handles. Users heavily rely on these rails for mobility support. This contact volume necessitates hospital-grade disinfection at every service visit. Beyond disinfection, the hardware itself must be tested. Emergency alarm cords must be physically inspected for fraying and verified for correct hanging heights to ensure operability. Treating accessible washrooms with generic cleaning schedules creates direct physical safety risks and exposes property managers to legal liabilities under building codes. The biological threat profile elevates significantly in washrooms that service medical, dental, or allied health tenants. Standard commercial cleaning is insufficient here. These environments require rigorous healthcare-grade protocols, demanding strict directional cleaning paths and color-coded microfiber systems to prevent cross-contamination between zones. To scientifically verify high-touch surfaces are clear of pathogens, crews use ATP testing. It instantly detects microscopic biological residue the human eye misses. A hidden danger arises in mixed-use buildings. When corporate office staff share ground floor facilities with medical practices, standard cleaning schedules leave massive infection control gaps. Managing this requires a split protocol. Healthcare-grade cleaning operates during medical practice hours, followed by enhanced commercial cleaning after hours. Implementing dual protocols increases washroom cleaning costs by roughly 15%. However, it is the only viable method to eliminate the extreme cross-contamination liabilities inherent in mixed-use properties. Modern facility operations have shifted heavily towards sustainable washroom consumables and systematic waste reduction. Diverting sanitary waste away from landfills to licensed clinical waste-to-energy processors creates a direct benefit. It actively supports a building owner's energy rating and sustainability commitments. This split counter quantifies a portfolio-wide transition from single-use plastic soap cartridges to concentrated bulk fill systems. Plastic waste drops by 340 kilograms, while consumable costs drop by 28%. Securing these benefits requires logistical discipline. Procurement teams must review sustainable products quarterly and test them at volunteer pilot sites before approving a full rollout. Ambitious sustainability policies do not inherently cost money. When procurement is executed properly, environmental targets directly align with aggressive budget optimization. When evaluating a hygiene provider, facility managers must verify 5 criteria: service flexibility, compliance documentation, infection control capabilities, sustainability credentials, and reporting transparency. The lowest cost provider is a trap. They cut corners, and those cuts inevitably surface as costly compliance gaps, overflowing waste units, and tenant complaints. The ultimate indicator as an elite vendor's service quality is total, unedited raw data transparency. A professional provider publishes every ATP reading and inspection score to a shared dashboard. Before signing a multi-year contract based on a pristine initial clean, facility managers must demand a 3-month trial period to verify the consistency of the operation over time. Commercial washroom hygiene is never a background service. It is a highly engineered environment, and it remains the most visible reflection of a building's true operational standards.